Hello, my name is Ryan Bain. Today I'll demonstrate the proper methodology for assessing mental function using a mental status examination, or MSE for short. Mental function assessment is an essential part of the physical therapy examination because cognitive impairments can affect the patient's ability to follow instructions, safely participate in treatment, learn new exercises, and make appropriate decisions regarding their care. This demonstration follows recommendations described by our 3 peer-reviewed sources, and we'll put those in the comment section.
Hello, my name is Carson Bowles. I'm going to be discussing the indications that we can use. So an MSE should be considered when a patient demonstrates confusion, memory loss, altered behavior, difficulty following commands, communication deficits, or suspected neurological or psychiatric conditions. It is also appropriate when establishing a cognitive baseline in older adults or after events such as a stroke or traumatic brain injury.
All right, there are no absolute contradictions to performing a mental status examination because it is non-invasive. However, clinicians should use caution when interpreting results in patients with hearing or vision impairments, language barriers, low educational attainment, severe pain, fatigue, delirium, or acute medical illness. These factors may influence performance without reflecting true cognitive impairment.
Continuing with the topic of indications, it is important to note how a patient presents themselves. As we can see in this first example, the patient is staggering, stumbling in, and does not appear very present mentally. This could give the clinician an idea of what they may be stepping into prior to performing an MSE. In this second example, the patient presents with a much more controlled gait, indicating possible normal cognitive function. Observations to consider are appearance, hygiene, eye contact, facial expressions, posture, behavior, gait, and speech.
How's it going, sir?
I'm good, how are you?
I'm doing good. My name is Ryan. I'll be your student physical therapist today.
Awesome.
I'm going to ask you a few questions, all right? Is that okay with you?
It's all right with me.
All right, fantastic. So, to start, can you tell me your full name?
Carson Bowles.
Okay. And where are we today?
We are at Advent Health University.
Oh, okay. What is today's date?
Today is the 23rd.
Okay. Why are you here today?
I fell and I got a concussion.
It happens.
That was clumsy.
These questions assess orientation to person, place, time, and situation. So it's always good to ask these. Okay, another question for you.
Okay.
Could you spell the word world backwards for me?
Yes, it is DLROW.
Thank you, I appreciate that.
Thank you.
That task right there, that's going to evaluate sustained attention and concentration. Alrighty. What is this right here?
That is a pen.
Okay. What is this right here?
That is a bracelet.
Very good. Alright, repeat after me, please. No ifs, ands, or buts.
No ifs, ands, or buts.
Please repeat these 3 words for me. Apple, chair, and blue.
Apple, chair, and blue.
Okay, thank you. If you don't mind, please fold this paper in half and place it on the table for me. Nicely done. Nicely done.
Thank you.
This assesses naming, repetition, comprehension, and ability to follow commands. Could you repeat the 3 words I told you earlier?
Apple, chair, and blue.
Very nice. That also assesses ability to follow commands and memory as well. A couple more for you. Thanks for bearing with me.
Of course.
How are an apple and an orange alike?
They're both fruit.
Very good. If you smelled smoke in your house, what would you do?
I would probably leave the house and call 911.
Okay. And do you know why do you think you're receiving PT today?
to assess my concussion, make sure my balance and everything is good. I've been a little wobbly.
All right, understood. Thank you for your time, sir. We'll come back with the results in just a few minutes.
Thank you.
Appreciate it.
Hi, how are you doing today?
Good, how are you?
Good. My name's Carson. I'm going to be your student physical therapist. I'm just going to run you through some questions before we get started here. So can you tell me your name?
My name is Kyle Smith.
Kyle Smith. All right. So, Mr. Smith, I'm going to ask you a few questions. Could you tell me where we are today?
We are in heaven.
You could say that. You could say that. Absolutely. Do you know what today's date is?
Today is April 23rd.
Right. What year are we thinking?
This is 2021.
Cool. Yeah. Oh yeah. And why are we here today? What seems to be going on?
Well, I don't know why I'm here today, honestly. I think it's BS that I'm here, but that's all right.
Okay. All right. I hear you.
All right, so the interpretation is going to combine observations with the patient's responses. A patient who is fully oriented demonstrates appropriate attention, recalls information accurately, follows commands, communicates effectively, and exhibits appropriate judgment and insight, demonstrates intact mental functioning. That's how our patient did. Carson, he did all those things.
All right. So abnormal findings such as disorientation, impaired recall, tangential thought process, poor judgment, or inability to follow commands may indicate neurological disease, dementia, psychiatric illness, or another underlying condition requiring additional evaluation. As we could see in the questions I asked Ryan, he was off on those. So mental function assessments provide valuable information that helps physical therapists determine a patient's safety, communication ability, treatment readiness, and the need for additional medical cognitive assessments. When performed systematically, the mental status examination is a reliable and efficient screening tool that supports clinical decision making.